in 2007 with incorporating biomarkers into the clinical and research diagnosis of Alzheimer's disease. First, in a very sort of subtle attempt to incorporate MRI and CSF and to talk about prodromal AD instead of MCI. But in 2018, it's actually sort of completely turned over and turned around, in the sense that we then decided, and I was member of this AAI Alzheimer's Association and NIA working group, to say, well, let's sort of do it the other way around, and let's diagnose Alzheimer's disease on the basis of biomarkers only. And that means that you will talk about Alzheimer's disease, and this is a research framework, but as it always goes, these research frameworks or guidelines, they gradually sort of find their way into clinical practice as well.
A picture of the future which is perhaps moving towards some description that has been tried in other conditions, often on the psychiatric end of the range, like schizophrenia and autism, where we think about Alzheimer's as much more of a spectrum. And given what you said about the upcoming kind of new compounds, new approaches and new targets,
yes,
I'm interested as to what new terminology we might develop to address these issues around, like you said, synaptic dysfunction, immunity and so forth, because it seems to me there may have to be a bit of a change to our lexicon as we describe these things.
Yeah, I agree completely. But it depends on the biomarkers to inform us on the presence of synaptic dysfunction, immune dysfunction, tau present, TDP43, what have you. And I think that's what I like about oncology so much. I mean, you just not look at the tumor itself, but you dissect it in all its genetic and all the other components, and you try to treat each of them. And I think that's where we are heading, and that's why we need companies like yours that are also developing new ways of looking into into the pathology and using biomarkers. I think that's where the future ultimately is.